Good afternoon, Winnebago membership, Winnebago community, and Winnebago workforce. This is the weekly update, pandemic coronavirus. And I wanted to start off again that we have families in mourning, and acknowledge that and pay that respect the way we always do as a people, and let them know that we're here and we understand. We understand what's going on over there. So we want to acknowledge what's going on and start off there. And thinking about these weekly updates, they're really important, and we understand that we have to keep going, and we keep having things for the people, so our people can have the information. So with that, I would like to move it along to our CEO of the 12 Clans Unity Hospital, DANELLE Smith.
Thank you, John. Good afternoon, everyone. On behalf of the Winnebago Comprehensive Healthcare System, thank you all for joining today's COVID-19 updates for the Winnebago community. I too would like to extend my condolences to the family who lost a loved one this week, and to all of the families in Winnebago who are mourning at this time. It is always a difficult time when we lose a loved one, and this pandemic situation and the need to social distance makes it even much more challenging for all of our families. At a time when we want to be together, we have to continue to follow all of the safety precautions in order to keep ourselves and our loved ones safe. Our community has experienced so much loss in recent weeks, and my thoughts and prayers go out to everyone who is affected by this. This week in Winnebago, we also had the opportunity to partner with Test Nebraska to host a mass testing in Winnebago for COVID-19. Mona and Angie will be providing details about this later in our presentation, but I would like to say that I appreciate everyone who took advantage of this resource. I think overall that the event went very well, and it was really good to be able to provide this great resource to anyone in the community and who works in Winnebago and the surrounding area, to have the opportunity for them to be tested if they chose to do so. Up until this point, due to the availability of supplies and to the unknown length of time that the COVID-19 pandemic is going to be affecting our community, we have been using testing criteria at the 12 Clans Unity Hospital to determine whether somebody should be tested. And that includes things such as whether the patient is experiencing symptoms, is living in a congregate living situation, or is a healthcare worker with a known exposure. We are in the process of reviewing our criteria, and as things progress and as availability of supplies become more readily available, we are hoping to be able to open up the testing more so in the near future. As soon as we are able to do so, we will provide that information when that's going to be implemented. The states of Nebraska and Iowa and all of the surrounding areas are beginning to relax health measures and the restrictions that have been placed on businesses. There are many businesses and recreational activities that had been closed are now opening, and their limited operations are beginning to open up and return to their normal activities. It's understandable also that people are tired of staying home, especially when the weather is nice. We all want to be able to go outside and to go back to those normal things that we're accustomed to doing. The Winnebago tribe this week also announced that the curfew has been modified to be changed from 7 p.m. to 10 p.m. until 5 a.m. So the new curfew is 10 p.m. to 5 a.m. And this is done in order to take into account the changing circumstances. But the tribe does continue to have its mask order in place, which means that anytime you're in a public place, you must be wearing a mask or a face covering. So even though other areas are opening up at this point, it is important to be mindful that the COVID-19 cases in the Winnebago community are continuing to rise, and the possibility of exposure to COVID-19 is just as high now as it was a month ago. COVID-19 affects each individual differently, and while it is hardest on those with chronic conditions and the elderly, it can also seriously affect young people. We must all continue to be diligent and to continue practicing social distancing, take care of our elders and our other vulnerable relatives so that they can stay home and be safe. I encourage everybody to continue limiting your activities in public places And if you do need to go out, to still do your best to maintain that 6 feet distance from others and to wear a mask. At this time, I'll turn it over to Mona ZUFFANTE, and we will move into the presentation and our updates regarding COVID-19. Thank you.
Thank you, Vice Chairman Snowball and DANELLE, for your good words. I also wanted to share my thoughts and prayers to all of our mourners today. So as DANELLE described, and Angie will go into more detail, the mass testing on Tuesday was a very huge success. I want to thank everyone that came out and participated. There was about 228 tests that were conducted. And as of today, we have received 193 results back, which will be reflected in our PowerPoint today. It was a very long day. I'm glad that everyone was very patient, and I know it was not quite how we envisioned, but the testing was completed, and that was all that we ever wanted. But if anyone has not received the results by Monday, please call or text the hotline 402-922-1508. And even though the hotline doesn't have the entire list of members due to the privacy, we will get your name to the appropriate person and then they can call you back. I also wanted to touch on the isolation cabins. They are available on a case-by-case basis, and we're trying to do the best that we can to manage all the needs of those isolated and quarantined families. I know that we've had some hiccups and are continuously working on them, but this is a valuable resource that the tribe has been able to make available for the community members in need. I also wanted to remind people that the cabins are only available during the isolation phase, and once the isolation is lifted, the positive person will be released and find alternative housing or can return back to their household depending on their case. We are working diligently to get a caretaker for the housing so that they can personally assist with coordinating the needs of those individuals. At this time, we continue to work between the PHN, CHRs, and Wildlife and Parks to meet the needs of the cabin's needs. There's also been a lot of research done over the past months, and it's been noted that people can still test positive for about 2 months after their initial quarantine isolation phase. So even though the 10 to 14 days is over and they're not shedding the virus, they have just not converted back to being a negative. And so I just wanted to let some of our people know that have been positive that even though you may test again, it's not because you are shedding the virus and able to pass it, you just have not converted yet. And that's been seen across the United States as well as through the whole country. So on a brighter note, the Kids Cafe has started, continues to provide about 350 to 300 meals daily. Just a reminder that last year we were only at about 150, so that is quite a lot of meals that they're providing. We've also just received notice this week that we will be able to continue to provide meals for Kids Cafe until whenever the school may start back up. The CHR program has continued to deliver supplies to our quarantine families with the assistance from the Food Sovereignty subgroup, the HCCDC, and Atlas. I know everyone is waiting to hear when the first Pet Care Day is, and that is being scheduled for July 22nd. If you miss that date, there's also August 19th and September 16th. It won't be located at the EMS garage due to, we believe, still social distancing practices will be in place. So we will be located at the Land of Wellness, and posters will be coming out very shortly. Our health promotions and outreach has several virtual check-ins and activities for the youth. So please check out our Facebook page for further details. I want to thank everyone for all that you're doing, and to the community. We are all in this together, and we're continuing to work towards a common goal. Again, thank you to all the staff that are working through this stressful time, and all those that continue to work behind the scenes. Now, Angie Keller, our Public Health Nursing Director, will start this week's presentation.
Good afternoon, everyone. I want to thank you all for taking time to watch this presentation. And again, I just want to echo the thoughts of John, DANELLE, and Mona with my condolences and prayers out to the families and loved ones that have lost a loved one during this week and during this pandemic. With the start of the presentation, the current statistics, and these are as of June 12th of 2020, the United States has had 22,418,861 tests completed. Of those, 20,009,742 have been negative. There's been 2,409,139 positives, with a total of 112,967 deaths. The state of Nebraska, there's been a total of 130,933 tests completed, with 114,458 negatives, leaving 16,315 positives with 212 deaths. For Winnebago, there's been 363 tests that have been completed, a total of 297 tests, 61 positives, and of those 61, 43 have recovered, a total of 1 death, and then there are currently 5 tests that are pending. For those individuals that are living outside of Winnebago, there's been a total of 198 tests completed, 146 tests have tested negative. There's been 48 positives, and then 4 of those are pending. As Mona and DANELLE touched on, we did have a mass testing event that happened on June 9th. It was from 10 to 2, and that was completed at the Winnebago Public School bus barn. It's been very successful, and we had many community members turn out for that testing, so it is very much appreciated that everyone did take part of that. It was a partnership with Test Nebraska, and it was staffed by the Army National Guard. It was open to anyone that wanted testing, that was whether they had symptoms or not, so they could have been experiencing symptoms or just wanted to know if they were positive. Individuals were able to pre-register online at testnebraska.com, or they were able to register on site. We had a total of 228 people that were tested, and that was both Winnebago residents and non-Winnebago residents. There was 92% of those tested were Winnebago residents, and 8% lived outside of the Winnebago community. The results were directly sent to the patients and were tracked by the Winnebago Public Health Department. Notification of the results were sent to the patients on a rolling basis as they were completed, so once the results came in, they were notified. And then as of Thursday, June 11th, 85% of the test results were completed and have been resulted in those individuals were notified. Stats from the event were associated with Winnebago residents are included on today's report. So the last current statistics did reflect the results that we had as of June 12th. And then what to go, so with testing completed, since there is a small amount that still don't have results back, I do want to go over what actions everyone needs to take. You need to continue social distancing measures. If you are experiencing symptoms, you need to make sure that you are then social isolating from the public and from household members just to help prevent any future exposure. And then you need to practice those measures until you do get your test results. If your test results come back negative, then you can discontinue that social isolation, but you do need to continue to practice social distancing measures, including wearing a mask out in public, cleaning public areas or high touch frequency areas around the house, so countertops, doorknobs, light switches, all that good stuff, and just following the other CDC precautions. If you do find that you did test positive, what you need to do is to continue that social isolation. You need to remove yourself from other household members or isolate yourself into one room from other members of the household. And then if there is more than one bathroom available, to please designate that bathroom as yours and clean it after every use. If it is not able to do that, if you're not able to do that and only have one bathroom in the house, it is a good idea to make sure you are cleaning before and after use, just to help prevent any future exposure to other household members. If you are found to be positive, contact tracing will be completed. A PHN or a contact tracer will contact you to go over that. It is best to try to write down a list of people that you have been in close contact with. So what that means is anybody that you've had contact with for over 10 minutes within a distance of less than 6 feet. And to make a list so then when you're called to do the contact tracing, you would have that available. The PHN or the contact tracer will notify all those close contacts you've identified and place them in quarantine, and we'll check on them daily as well as the individual testing positive, just to make sure everyone's feeling well, and if any needs or issues arise, then we can help out with those. As Mona had mentioned, there has been the food assistance has been going out with those that are in isolation and quarantine, and this is numbers as of June 12th. So all patient information regarding COVID status, so results, those being tested, those in quarantine, those in isolation, is all protected health information, so that information is not distributed. When a person tests positive for COVID-19 or is identified as a close contact, their household is placed on quarantine status. The length of time can depend on the status each household member it has based on their COVID status and is based on the CDC guidelines. A notice of instructions is given to each household. The PHNs check in with each household daily to ensure that health and basic needs are met. And as of Monday, June 8th, there was 31 households that were currently in quarantine or isolation status. So just to elaborate on that a little bit, there are times where people can be in quarantine a little bit longer depending on how many household members are positive, and the PHNs will definitely, when they're checking in on you, will update you on the date that everyone can get out of their isolation or out of their quarantine. And then the food-related programs available, I just want to go over those with you here quickly as well. Our Farm to Family Initiative by HCI and HCCDC are distributing up to 160 USDA food boxes each Friday during the month of June, along with the native food items purchased with funds from an anonymous donor. 25 of these boxes are reserved each week for distribution by the CHRs to households in quarantine or in isolation. The June 5th delivery will also include hand sanitizer from FEMA. Then WCHS COVID-19 care packages, one box or one bag is delivered by CHRs to each household on quarantine or in isolation. These may include items such as bottled water, Gatorade, facial tissues, hand sanitizer, disinfectant wipes, paper plates, plasticware, cough drops, masks, and fresh produce. The wildlife and parks cabin quarantine housing, so Mona did touch on this as well. Those individuals, they will get a prepared lunch. That's a lunch that is delivered Monday through Friday, along with other food and basic supplies. The Atlas Food Pantry, one box of food each Monday for each new household that's on quarantine status or in isolation is delivered by the CHRs. The Kids Cafe that is doing so well right now, the meal delivery to families who have been referred to the Winnebago Public Health Department, those are happening. The Senior Citizen Center is going to be back up and operational next week, and will be receiving their meals as they did prior by the staff. And then there is the senior grocery shopping service that's available by the CHRs, and that's grocery shopping and delivery for seniors requesting this service. And it can include 10 seniors per day and then up to 3 times per week. So those are all the food-related programs that are available here with the Winnebago Public Health Department. If anybody does need those, please reach out to the CHR office or the PHN office. And then I just want to thank everyone for taking part in this update and doing everything you can to keep the community healthy and safe. What you guys are doing is making a dramatic difference, so please continue to do that.
Thank you, Angie. That concludes the WCHS presentation for this week. And so now we will turn it over to Winnebago CEO, Esther Mercer, for her update.
Thank you. Good afternoon, everybody. Thank you for joining us today. Before we begin the tribe's portion of the update, I would like to express my condolences to the families that have lost a loved one this past week. Our thoughts and prayers are with those who are in mourning and to all of those who have lost a loved one due to the COVID-19 virus. This past week, the tribe announced the availability of funding to support households with housing and utility assistance. The application is available for download on the tribe's website. The applications are being processed by the Winnebago Tribe of Nebraska's Human Service Office. If you need assistance with completing the application, please contact the Human Service Department to complete your application over the phone. The Winnebago Human Service Department has accepted and is processing multiple applications related to the CARES Act housing and utility assistance. Several tribal members have expressed concern regarding a deadline for getting the applications in. As of today, the only deadline that is in place is the need to spend out the funding before December 30th or until the funding is depleted. So please continue to submit your applications as you are able to. The tribe will continue to accept and process as long as there is funding available. The tribe would also like to remind the community of the Human Service office hours, which are from 12 p.m. to 2 p.m. Monday through Friday. These are the only hours that the Human Service Office is open to the public and are able to accept in-person applications, as they are very busy working on processing all of the incoming applications in a timely manner. Please work with our Human Service staff on respecting these time frames, along with wearing masks and following social distance guidelines while picking up or dropping your applications off. The Tribe and Human Service Office greatly appreciate your cooperation and patience during this time, as we are trying our best to ensure that all eligible tribal households are able to receive this assistance in a safe and timely manner. To complete your application over the phone, please call 833-568-7882. The form can also be accessed online at thewinnebagotribe.com. Please send all completed applications via email to wtnhumanservices@winnebagotribe.com. Please continue to adhere to all social distancing guidelines as set forth by the CDC and the Tribal Public Health Department. That concludes the update for the tribe. Thank you and have a nice weekend.
Thank you, Esther. Up next is Dan Farringer with the Winnebago Public Schools. Dan?
Good afternoon, everyone. First of all, my heartfelt condolences go out to those families in mourning. As far as the school, the weightlifting and conditioning started Monday, June 8th. Things seem to be going very well. Coach Barrage and Coach Bear are in charge of this. And if there's any other student athletes that want to come down that haven't been down there, they just need to remember to get the signed waiver before they can start. We are also finalizing plans to bring small groups of students who need academic support back into the building for summer school. We'll have a meeting on Monday to finalize all the plans, and we're planning on starting the summer school for some groups on June 22nd. We've already contacted some parents, and we'll continue to contact the parents through next week. We're bringing the staff that's going to be working with those students in this week or next week for some training to make sure we follow the proper protocol. And hopefully we'll get things. I believe we're going to have a 4-week block of summer school Monday through Thursday, and the times for each group will be, the parents will know that. We're still working on the transportation issue for the elementary students. The playground should be completed today. That will be huge. And then the track construction is near completion. They're supposed to be in this weekend to paint all the lines and all the markings on the track to finish up next Monday. And hopefully I will be able to open the track to the public toward the end of next week, once everything. And there'll be certain times, because in the morning will be for the athletes. For the girls, I believe the boys and girls switch from 9 to 11:30, and then the afternoon till 3 is for the other group. So anytime after 3, it should be open to the public. We'll continue to keep working on. There'll be a parent survey coming out. We're finalizing that to school for next year's group. That's going to be meeting so that we get an idea of what parents are thinking as far as their plans for next year and what they think would be safe and not safe in some of our things as we start planning for that fall semester. Again, continue to practice safety measures so that everyone can stay safe. Thank you.
Thank you, Dan. Up next, we have MANOJ with Little Priest Tribal College.
Hello, everybody. First, I just want to share my heartfelt condolences to the family in mourning, and also pray for a fast recovery of anyone who has been infected by this virus. Just a quick update from Little Priest Tribal College. Our summer 2020 classes are going very well. It's completely online. Student support services are in constant contact with students to make sure if there is any needs that can be taken care. If you're still having any issues, please contact Tricia Wagner at 402-878-2380. We want to make sure that academic progress doesn't stop, and if there is any issues, we would like to fix it right away. That's our mission, and that's our goal for the institution. As we get preparing for the fall 2020, we have some exciting news coming up. June 17th is our board meeting. So pending board approval, Little Priest Tribal College will be moving to online instruction in fall semester as well. There will be some tuition grants that will be available for Title IV eligible students. Again, I just want to remind, this is all pending board's approval. As soon as the board approves all these things, all the information will be shared on the college website, Facebook pages, and through different social media and TV media, so that we can start the registration and recruitment for fall 2020. And we are very excited with the opportunities we are going to be sharing with the community. Our tentative date for graduation is July 29th. Once that's all confirmed, we'll be sharing with the community. It will be a virtual graduation. We are very excited to honor and celebrate our graduates' success. Little Priest Tribal College is still planning to open the college on July 6th on a rotational basis. A rotational matrix has been created for employees only. No guests, no visitors, no family members will be allowed on campus at any time. Strict temperature screening and health screening will be implemented throughout the campus for ensuring safety of the employees. I wish everybody a safe weekend, and again, our condolences to anybody who's mourning during this crisis time. Take care.
Thank you, Manoj. At this time, we will have Mayan Beltran from the Winnebago Casino and Resort giving an update. Mayan?
Hello, everyone. Also like to express my sincerest condolences to all the mourners out there during this time. From Winnebago Casino Resort, we have opened the doors Friday, June 12th at 10 a.m. We have implemented many safety measures and protocols, including temperature checks prior to coming in, must be under 100 degrees. Otherwise, we'll do a secondary check or refer you to your medical provider. We are requiring masks at this time of all guests and employees. Gloves will be worn by certain departments dealing with cash and handling things that are touched by other individuals. No smoking in the casino during this time. We do have designated smoking areas outside. We have one entrance in the front entrance and an exit in the middle entrance by Class 2 and 360 Lounge. One entrance entry into the hotel. The hotel is only open from Thursday through Sunday. Our operating hours are from 10 a.m. to midnight, 7 days a week in this first phase, so that we can close down and do deep cleaning every day and be ready to open again the next day. No one under 18 years of age is allowed into the casino in our first phase. Again, our utmost safety concerns are to protect our guests, our team members, and our communities from this virus. So we're doing all the safety protocols that it takes to be a little stricter than most. We did open later than other casinos in the state of Iowa to ensure that we're taking all these protocols seriously and to monitor the data in the surrounding area. And we feel that we are doing everything to the utmost safest that we can for our team, our guests, and our communities. So a lot of this will be on winnevegas.com if you have any questions, or we understand also that not everyone is comfortable going out yet, going to frequent casinos and things like that. We understand that. We're ready when you are ready. So we are open now. The people that want to come out and gamble know that we're taking all these precautions. And some people might not like some of those precautions just because it seems over safe, right? But we can always let loose a little bit later. We just want to ensure the safety for everybody in the beginning. So we thank you again from Winnebago Casino Resort. Our condolences to the mourners and anybody affected. We wish you a safe recovery and a quick recovery. Thank you very much.
Thank you, Mayan. At this time, we have Sam Burrish giving an update for HCI. Sam?
Good afternoon. Thank you, Emily. First, on behalf of the company, I'd also like to offer our condolences to the families in mourning. I have a brief update today. Thanks to the anonymous donation mentioned earlier, $50,000 worth of Sweetgrass Trading Company food products will go to community members at no cost. These items will supplement the produce from the USDA Farmers to Families Food Box Program and started being distributed with those food boxes on Friday. Sweetgrass Trading Company is a subsidiary of Ho-Chunk Inc. that distributes traditional Native American foods, gifts, health and wellness items from many partnering tribes. So we're excited to help create some economic ripples that way and supplement that food program. You can learn more on the Ho-Chunk Inc. Facebook page. Another activity happening in the Ho-Chunk Village is the Farmers Market. The market starts this coming Wednesday, June 17th. It's from 1 to 6 p.m. at the new Village Market building behind the Dollar General. Please remember there are safety precautions. You can find more details on that on the Ho-Chunk Village Farmers Market Facebook page. With that, I'll turn things over to Brian Mathers with HCCDC. He's involved in both of those projects as well.
Thanks, Sam. Yes, we had this last Friday, we had 240 of the farm to family boxes, and that's kind of the number that we're planning to go. I did some checking with the distributors and the legislators to see how long they expected this program to be available, and we expect to be able to offer it Fridays through the end of the summer, at least. So that's good. So we'll continue to do that on Fridays. We'll have the farmers market starting on Wednesday, so there should be a good opportunity to access this fresh, healthy food throughout the whole summer at least. So that's great. Sam also mentioned the farmers market, and we have some grants available we're still looking for more vendors for that farmers market. And we have some grants available to help vendors get set up to start selling. So it's free money, basically, if you're doing food-related products and you're willing to sign up to be as a vendor for the full season. You can get a grant to help with up to $1,000 in startup costs for initial inventory or advertising stuff or packaging things or whatever you would need. Tables, chairs, whatever you would need for your booth. And that's $1,000 that you don't have to pay back. And it's just through this simple grant application process. And you can apply through Tony Wood, and his email is twood@hccdc.org. So if you're interested in being a vendor and that's something that could help you ramp up and be ready to start selling right away, please get in touch with Tony and we can get you hooked up with that resource. I just also wanted to mention that we got some additional donations this week from foundations. The Mutual of Omaha Foundation contacted us and wanted to make a donation to go towards a community COVID-19 response. And from talking to them on the phone, they've been kind of observing what's been happening in our community, and they were very impressed with the level of collaboration and teamwork and how the community is really making steps to take care of themselves and kind of solve some of these unique challenges that have come with this pandemic. And they were very happy to see that, and they said they wanted to be a part of that. And so they made a $25,000 donation through our organization that we can use wherever the community prioritizes it. They wanted us to look at the food and nutrition issue, the distance learning and digital divide issue, and then also with possibly housing, either through rent relief or if there's special upgrades or things that are needed to help with the quarantine housing. So we'll be working with subcommittees to figure out the best place to use those donated funds to help with the overall effort in the community. Our condolences as well to the families that have suffered losses or that are still dealing with the pandemic. I know it's a long slog. We're in week 13 of this, of just these meetings, I know. But I do think there's definitely some encouraging signs. Casinos opening up, testing event went well and really didn't reveal a high level of illness. So that seems to me like a good trend. So we just got to stick it out and stay safe and keep doing what we're doing for a while longer, it looks like. Thanks, everyone.
At this time, we will have Chair of the Winnebago Pandemic Task Force, John Snowball, give an update. John?
Thank you. I wanted to start off this update by saying pinigigi wanigin option, you know, that to everybody that has played a part in the preventative measures and to the response of this pandemic. And you know, thank you. You're doing good for us, and we understand that. And especially the IT and communication departments who have proven to be very vital for us to continue to meet and get information out. So I wanted to acknowledge that. And the most recent thing was that we modified our curfew, and it wasn't no reasoning for easing up. You know, we understand that we're right in this. You know, that it's just as much of a threat as it always been. You know, but we wanted to call on each community member and understand how powerful that is, and how powerful each member taking responsibility, and how we do have those people, those good people, and we wanted to call upon that. And so on behalf of the Tribal Council, on behalf of the task force, and you know, I want to do that right now to call on each community member to be safe and to look out for your children and your elders, and because that's the most powerful thing, and utilize the Creator's gifts, the gifts that He gave us, the gift of thought, and the gift of language, and the gift of choice, and mostly the gift of love. You know, that we're doing this because we love each other, and we're special people, the Creator's people. So I wanted to say that much. You know, that was the reasoning behind that. You know, it wasn't because we think there's less of a threat. You know, we understand that it's just as much as a threat as it's ever been, but we wanted to call upon our community members, and how that's real powerful, and how we trust them to do that, and how each one of us is gonna play part in that, and how that's gonna be powerful, and more powerful than anything. So I wanted to say those words, and understand that, you know, we're gonna keep going. You know, we don't know how long, and we're each one of us is adjusting our lives, and because we have to, you know, and learn to live with this. You know, even myself, I haven't been around anybody, you know, and if I had to make that list of my close contacts, it would only be the people in my home. Those are the only people I'm around, and even my own father, you know, I call him every day, and my younger brother had a birthday over there, and I kind of bought some things for him, you know, some presents, some things that he likes, and I took it over there, and I didn't go inside, and you know, I met my dad at the end of the driveway and gave it to him, you know, to protect his family and to protect mine. You know, that's what we got to do. You know, think in our minds that it's always there. You know, I may have it. You know, I don't want to give it to anybody, and so we really got to look at each other like that, and understand that we're in this together, and that's the most powerful thing we can do, is each of us take responsibility and understand that the Tribal Council and the task force really trust each one of us, you know, really trust each community member to be safe, you know, that we don't want to put these measures on you and be unreasonable, because we do trust you, and that's how we're gonna get through this. So thank you.
Thank you for those words, Vice Chairman. At this time, we will move into the question and answer portion of our live stream. As a reminder, please send all of your questions, health related, to covid@winnebagotribe.com, and we will do our best to answer them in next week's live stream. So the first question is, how many positive cases was there from the mass testing event? Mona, can you answer that one?
So as of today, we have received 194 test results, and we had 193 negative results, which was reflected in the update with the numbers for Winnebago.
Next question. Will the health department be testing all Winnebago's employees now that they are open? I think it should be part of the reopening process. Mayan, can you speak on that for Winnebago?
Sure. It wasn't decided to test all the employees to reopen at this time. We do have our safety protocols in place where we do the temperature. If it's over 100, we'll do a secondary check with a different thermometer. If that's over 100, we'll go through a couple of questions, and then we'll refer that individual to their local medical provider. But in conjunction with the tribe and the health department across the Winnebago, I'm not opposed to doing testing for all of our employees. I think it would be a great idea to ensure that everybody is safe and a non-negative or a negative, however you say that. But at this point, it wasn't decided to do that for the employees.
Okay, thank you. Danelle, Mona, do you want to add anything to that, or?
I think we can definitely look at implementing something like that after supplies, as Danelle alluded to, looking at some of the criteria and whatnot has been opened up, and we're able to purchase more supplies.
Okay, great. Thank you. The next question is, what do we do when we see a person we know that has COVID at Winnebago? Danelle, Mona, can you answer that?
As we've mentioned before, patient information regarding their COVID-19 status, whether they've tested positive or whether they've been placed on quarantine, is protected information under HIPAA. So we are not allowed to release those names to the public. It is also important to note that once a person is placed into quarantine or isolation, they don't stay there forever. There is, a time period in which that applies to them, and so at some point people will be, coming out of quarantine and able to move around into the community and that type of thing. As we also have mentioned, the public health department does check in with each of those people on a daily basis and reminds them. They're all provided with instructions, and it really is a matter of personal responsibility for them to maintain their quarantine status and stay home and not go into public places. Outside of that, all of the safety precautions are put into place at Winnebago and in public places throughout Winnebago, where community members are required to wear masks. And those masks and that social distancing is really what is going to keep you safe from anybody who might have COVID-19, whether they've tested or not, because somebody could be out in public before they even start having symptoms, and they may not know that they have COVID-19. And so that's why it's important for each and every one of us to take those precautions seriously, maintain that social distancing, and wear a mask so that you can protect yourself.
I was very impressed with all of the measures that Winnebago has put into place in order to create as safe an environment as they possibly can, from taking the temperatures at the door to having sanitizer all over, of course, having the masks that everyone has to wear, to the contraptions that they have made for the bingo players. And so I think Winnebago has went above and beyond, also having social distancing software on their slots beyond our expectations. And so I really applaud their efforts.
That concludes the Q&A portion of this week's update. As a reminder, please email any questions you have at covid@winnebagotribe.com. And I want to thank everyone for participating this week, and also thank everyone for watching.